Hi, my name is Dr. Peter Jung from Bluefish Pediatrics, and I'm here to talk to you today about fever. Fever is one of the most common questions that we get in pediatrics. So what happens in your child's body when they have a fever? When a germ such as a bacteria or virus enters into your child's body, it will trigger the immune system to release a set of chemical signals, which will then tell the brain to release a different set of chemical signals, triggering fever, which is defined as any temperature 100.4 or higher. Fever is actually purposefully created by our body to help fight off germs. So if this is true, why are parents so concerned about fever? Well, typically two reasons. Number one, they're worried that the fever itself may hurt their child's body or possibly even fry their child's brain. And number two, they're worried that the fever will spiral out of control. The good news is that neither of these are true. When fever is created by your body, it will actually be kept in a very tight and controlled range. On the first day, as the germ enters the body, the fever will go up and it will stay in between 102, 103, 104, 105, and by the fourth or fifth day, as the body defeats the germ, the fever will go away, and all the while the fever will stay in a very specific and tight range. The other reason that parents get worried about fever is they've all heard of something called febrile seizures. And febrile seizures are when a fever triggers your body to have its legs and arms start jerking violently back and forth, and you may notice that the eyes will start to roll backwards and you may see some foaming at the mouth. While febrile seizures can look dangerous, they actually are not. And in fact, they are quite common. Up to 5% of all children may have a febrile seizure at some point in their life. The good news is that there is no harm from a febrile seizure. But just to be safe, it is a good idea to touch base with your pediatrician to make sure that there is nothing more serious going on. So, when do we as pediatricians get concerned about fever? Well, if it gets above 107.6, you definitely need to call your pediatrician. The good news is that those numbers are very rarely, if ever, seen in a pediatric office. When we see a child with fever, the main thing that we are actually wondering is what is the source of the fever? So when you have a fever, is it coming from a virus or is it coming from a bacteria? If it's coming from a virus, is it a stomach virus or flu or cold or meningitis or some other type of virus? If it's a bacteria, is it a skin infection or sinus infection or ear infection or urinary tract infection or strep throat or meningitis or some other type of bacterial infection? The things that we will look at is your child's history and their physical exam, and what you can help us with is looking at your child's overall activity level. The more active they are, the less concerned we are about the source of the fever. So you can look at their energy level. For example, if they have normal activity, and you can look at their interaction and they're talking freely, and their appetite, if they have a strong appetite, and all of these things are strong, then you know that it is very unlikely that the source of the fever is dangerous. However, if your child is acting very weak, laying around all day with very little eye contact, hardly drinking at all, those are the children that we get concerned about and definitely need to be seen in the office to make sure that there is not a serious source of fever going on. Now, when you have fever, one of the things that you can do at home is to give a fever reducer. But believe it or not, it's actually better to not give the fever reducer if possible. As we talked about, fever is purposely created by your body to help fight off the germ, and to that end, it's actually better not to give a fever reducer when at all possible. So especially if your child is acting fine and talking freely and has a good appetite, it's best to just leave that fever untouched. But if you feel like your child is acting very weak and you are concerned that they are not drinking at all and may possibly get dehydrated, in that situation, it may be a good idea to give a fever reducer to try to make the child more comfortable so that they will drink appropriately and not become dehydrated. When you do use a fever reducer, typically we believe that one medication is safer to prevent any kind of overdosing. And we generally like ibuprofen as our treatment of choice, and you can give that every 6 hours. Should you be giving the ibuprofen every 6 hours and you feel like the child is still uncomfortable, it would be reasonable to use a second medication such as acetaminophen or Tylenol and give that staggered with the ibuprofen such that one medication is given every 3 hours. We never recommend using aspirin for fevers in children. So you should always use either ibuprofen or acetaminophen. But to reiterate, probably 0 medications is better, but if you're going to use a fever reducer, 1 is safer. So in conclusion, when you have a fever, remember that the fever is purposefully created by your body and that the fever will stay in a very tight range when you have fever, and that should you have a febrile seizure, it is not dangerous to the child. And remember that we are more concerned about what the source of the fever is, and the overall activity level of the child will help us to know how serious the source of the fever is. And if you're going to give a medication, 1 medication is always safer than 2. I hope that the next time your child has a fever, this information will help you feel more comfortable and safe at home.